listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 19, just 21 weeks to go. You can see a picture of what your baby looks like this week, read the transcript, and access all of the additional resources at pregnancypodcast.com/week19. Your little bell pepper is growing to about the size of a mango this week. Your baby measures 9.5 inches or 24 centimeters long and weighs 9.6 ounces or 273 grams. You'll be happy to know that their little arms and legs are correctly proportioned. As their nervous system continues to mature, the neurons between the muscles and the brain connect, which gives your baby control over their movements, and their gums now have tooth buds in them. Another significant development this week is that your baby is getting covered in a protective coating called Vernix Caseosa. This is a greasy, white, cheese-like substance that protects their sensitive baby skin from the amniotic fluid. This coating sheds as birth approaches, although some babies will still be covered with some Vernix at birth, especially if they're born early. By week 19, you will have ideally gained between 8 and 14 pounds. Of this total weight, 6 ounces is the placenta, 11 ounces is the amniotic fluid, and 12 ounces total for both breasts. As long as you're eating healthy and getting some exercise, I wouldn't worry too much about weight gain. You may be noticing some changes to the pigment in your skin. A stripe down the center of your belly called a linea nigra might appear in the second trimester, and this will get darker as your pregnancy progresses. This is common, and it will fade after you have your baby. An increase in melanin production causes some expecting moms to get melasma. These are dark patches of skin. They usually appear on your forehead, your cheeks, your nose, or your upper lip. Sun exposure can make this more noticeable, so wear a hat or sunscreen or both to minimize the sun on your face. Informed consent is an essential component of communication between medical professionals and patients. Proper informed consent means that you fully understand the procedure, the intervention, or the treatment, that you know all of the risks and benefits, and that you have the choice to opt in or opt out. Organizations like the American Medical Association and the American College of Obstetricians and Gynecologists define guidelines for informed consent. A significant challenge for providers to give proper informed consent is the time allocated for each appointment. Hopefully, this will be a bigger priority as we're seeing a shift to more patient-focused practices and more evidence-based care. There is an episode of the Pregnancy Podcast with tips for finding the right care provider, ensuring that you are informed before giving consent for procedures and interventions, and some red flags that you should switch to a new doctor or midwife. You can check out that episode at pregnancypodcast.com/informed consent. A tip for dads and partners: go for a walk with your significant other. Walks are an excellent way to get in some activity, to breathe fresh air. Plus, this is an opportunity to talk about how you both feel and how you're preparing for all the changes ahead. And this doesn't have to be a power walk or an intense hike. You can grab a coffee or a tea and go for a stroll in your neighborhood. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week19. Next week, you can find out if you're having a boy or a girl if you don't already know. Until then, I wish you the very best in your pregnancy journey.